Let's ask Christopher Snowdon, the head of lifestyle economics at the IEA, what he makes of this. Christopher, it's fairly easy, isn't it, to say this model cannot be sustained, it won't work, but not suggest an alternative?
Oh, it is, but at least he said that, and he is speaking the truth. The IEA have been pointing out for many years that we have much worse health outcomes than comparable countries across Europe, which have a much better system. The reason, I mean, I'll say it if he won't. What needs to be done is, yeah, people should be paying for GP appointments. They shouldn't be getting paid for people having patients on the books. They should be getting paid for seeing patients. The Department of Health should only exist to make sure everybody can access health coverage, and in other words, make sure everybody has health insurance. The NHS should be stripped down to providing emergency care, which is actually pretty good at, certainly when it comes to ambulances. And all the hospitals should be privatised, and there should be genuine choice for patients, and that will lift standards. It will weed out bad managers or bad doctors, but the mere existence of competition, which we don't have any of at the moment, will lift up standards, and this is what the rest of Europe is doing. It's
so
what
you
the
mean
rest of the developed world is doing.
So you mean privatised in the same way that Thames Water has been privatised? Used to be nationalised, now it's privatised. Our seas are being pumped full of sewage. We've just said that the rivers have turned black and the fish have died in multiple numbers. I mean, the same is true of various rail services which have been privatised. The idea that privatisation is some kind of ideal to which we ought to aspire, and that the moment something's privatised, the business model kicks in, competitiveness kicks in, value for money kicks in, efficiency kicks in, would be delightful were there not so many examples of this not working at all in practice.
But it does work in practice in Germany, in Switzerland, in Sweden, in Norway. You mean, really, you name it. There is no other country that has the same model as the NHS. There's other examples that you mentioned. I mean, you do have valid points, but those things are kind of either botched privatizations or they're natural monopolies. Hospitals are not a natural monopoly. Healthcare is not a natural monopoly. There is no reason at all why the NHS can't be splintered up and you have different people running different hospitals. And when you get sick and you need an operation, you have the option to either have it locally, but if they're not going to do it in time, you can have it 20 miles or 50 miles up the road. But you have choice. It's really not a mind-bending idea, this, Vanessa. It happens everywhere else.
Except that we have people at the moment.
They think we're so weird.
Except that we have people at the moment not making choices about hospitals, but making a choice between heating and eating. We have people who have to shop only at the most expensive convenience supermarkets because they live without public transport. They can't get around the place. They don't have cars. They don't have choice. Choice is a matter of finances. If you have the money, you have all the choice in the world. If you have an urban environment with plenty of transport, lots of money, you can choose all sorts of things. If you're in the countryside or far from transport, you don't have a car, you don't have any cash, you're absolutely stuck and totally stymied. Now, Dr. Ellie Cannon has effectively grown up in the NHS. Lots of us have been born into it, but she's literally been growing up in an NHS family. Her father was kind of the NHS heart, soul, lungs and everything, spirit. So I wonder how you feel, Dr. Ellie, hearing it casually suggested that instead of being free at the point of service to all, the NHS should effectively be privatised, and that's the only way to take this model forward.
Well, I mean, obviously, there is a whole spectrum of healthcare systems that are between the NHS, which is a completely socialised healthcare system, and a completely privatoid American system. And you don't just sort of jump from one to the other. And certainly, of course, I would not recommend sort of Christopher Snowdon's idea. And you're absolutely right when you talk about privatisation. Privatisation is not the gold standard. It hasn't been the gold standard for Thames Water, obviously, but it also isn't the gold standard in terms of healthcare. Actually, the NHS already utilises a lot of private services. In my GP surgery, we use private scans for certain situations. We use certain sort of other private systems. And you know what? It isn't all great, actually. Adding that competition, it isn't all great. It all becomes very transactional. Patients often don't like it. We often sort of don't trust the clinical outcomes that we're offered. So actually, this notion that private care is gold standard is absolute nonsense. Just look at what private hospitals did or didn't do during the pandemic. But what Sajid Javid does say, which is actually quite valuable, is that we need to look at a non-partisan approach to the NHS. And he's absolutely right. The NHS has suffered over decades of these populist approaches. We've seen loads in the last few years from the Conservatives. We also saw it from Labour as well, where you get these ideas, what we're going to do, the workforce plan we had last week, this, that and the other. And it changes with each government, or with the wind, or with the Conservatives. That we've had so many health secretaries. I'd even forgotten Sajid Javid was health secretary, to be honest. So absolutely, I would welcome the idea of it being taken out of politics. I think the idea of a Royal Commission is a really good one, only a year long. Try and work out what we can do in order to move things forward away from the political parties.
Let me bring Peter in with this, because the idea of the NHS being free to all at the point of service, so free if you're having a baby, free if you need your tonsils and adenoids out, free if you, God forbid, have a stroke and have to be rushed in an ambulance, free if you need to be stitched up in casualty, just free if you're having an alcoholic episode and need to be hoovered up off the street, free if you've got an addiction, free to all of us at all times throughout our lives and indeed in death, is pretty much sacrosanct, isn't it? It's the sort of thing, I mean, at the beginning of the opening ceremony of the Olympics, there was an obeisance and reverence and homage paid to the NHS because of this free to all at the point of service idea and concept, wasn't it? So would any political party risk saying that this was something that they would tamper with or tinker with or change?
I don't think they would, but it's interesting. If you have a Royal Commission and it has an idea around this to try to save the NHS, and if you can sell it essentially as saying we want the NHS to be as much as it is at the moment, but it's not going to survive in that way. But yes, you're right. It is the closest thing we have in this country to a national religion, because of the demise of the Church of England. So it is definitely something that is really close to a lot of people's hearts. They don't want it to change, but at the same time, we're paying the highest taxes as a proportion of what the country makes since the war, yet the public services we're getting, not just in the NHS and elsewhere, are not up to the standards that people need or would like. So certainly a conversation can be had, and I think Sajid Javid is probably on to something here, but the question is, I suppose, where it goes from here.
Let's bring Christopher Snowdon in on this. Christopher, is the idea that if people had to pay, or indeed pay for private health insurance in order to access healthcare of all kinds, they would simply be less unhealthy, they would go to the GP less, they would have fewer minor procedures, they would maybe take care of themselves and eat better and exercise more, so they would be less likely to be, for example, diabetic? Is that the idea, that if you have to pay, you'd be more wary of actually being ill and using the NHS? Is that what you mean?
I don't think that would actually happen. If you look at obesity rates in America, you can see that it doesn't happen in that particular area. I think it would cut down on some of the malingerers in GP surgeries, but it wouldn't be transformational. I've got to make something very clear, which perhaps I should have made clear before. I am not talking about not having access to healthcare free at the point of use. All the countries I'm talking about have universal healthcare. What I'm saying is the government doesn't need to provide that healthcare itself. There was never any reason why the government had to own the infrastructure and own the hospitals. We are paying well over £4,000 per man, woman and child for healthcare in this country. That's for a family of four, over £16,000 a year. I'm suggesting that money could be spent more efficiently. And what I'm arguing for is universal healthcare, in which either you have people who can afford it get health insurance out themselves and people who can't get it paid for by the state, or the state pays for everybody's health insurance. I'm not really too bothered about that. What's important is I want competition and choice for patients. And can I just say, by the way, GP surgeries are privatised. And I've never heard GPs asking for GP surgeries to be nationalised. They don't work very well, before you mention that privatisation doesn't work again, Vanessa. They don't work very well because they've got a sweetheart deal from their only client, which is the government, which means the GPs get paid for having people on their books rather than seeing them. I would like to see them paid only for appointments.
I'd like to ask Dr. Ellie Cannon about this idea of choice, because, Christopher, you're obviously very keen on it, and certainly it's something that we've heard more and more of in terms of medical care over the years, particularly, for example, women in labour must have a choice. They must be able to choose whether they want a water birth and whether they want an epidural and whether they need a caesarean and whether they don't, and which gynaecologist they want, which obstetrician they want, all this kind of thing. It sounds terrific. It sounds sounds as if there's a menu, you get to pick. But in practice, all sorts of things happen. First of all, you don't know because you're not a doctor. You don't know what you're choosing. You've absolutely got no idea what you're picking from or why you're picking what you're picking. So when you say they can choose which hospital, choose which surgeon, choose which stitches, we don't know. We the uninitiated, we the grey unwashed have got no idea which surgeon we'd rather have, or which prosthetic we'd rather have, or which false knee or hip we'd rather have. We don't know. So yeah, we could choose, but choose from what? From a position of what? We don't know what we're talking about in the first place. So this idea of kind of liberation and autonomy and choosing, I think is a kind of watchword that's utterly meaningless. Dr. Cannon, I'm sure you've had to deal with this idea that we want the choice and we get to choose, but do we know what we're choosing? Do we want to choose?
Yeah, I think, you're absolutely right, what you've just said. I mean, I think the concept of choice, unfortunately, is really a sort of political posturing point. And actually, in reality, as you say, the patients in front of me, when they are offered a choice, they want to go to the antenatal clinic, where who's going to see them as quickly as possible. So that's sort of what they're going to go for. So, or they're going to go to the sort of the one round the corner. And the fact of the matter is that choice really is only available to those people who have the privilege to choose. So, as you say, who are educated enough to be able to sort of read about these choices, who have transport in order to get to those places, who have the finances to get to those places, and all of those sort of things. And one thing that Sajid Javid didn't mention, which is interesting because he was Chancellor in his article, which hasn't been mentioned now, is that essentially health outcomes, they might be a measure of how good your health service is, but they are also a measure of how poor your country is. And at the end of the day, when we have massive levels of deprivation, when we have unemployment, when we have people who are not getting their kids into the schools that they should be able to get their kids into, that their kids aren't as educated as they should be, and all of these types of things, deprivation, that is also affecting our health outcomes, not just our health service.
Well, thank you all very much indeed. Thanks so much.